Hello. In this video, we are going to discuss a very serious case of a 19-year-old married woman who has a 2-month-old baby, and she seems to be experiencing some kind of psychotic experience where she thinks that she has found the secret to world peace and she wants to give her baby back to aliens to achieve it. So, my assessment of the patient suggests that she is going through postpartum psychosis. I identify the situation as a crisis and I would initiate a crisis prevention intervention in response to this patient's problems. I would follow the 7-stage model of crisis intervention, which was developed by Albert Roberts, which provides us a very systematic approach to help individuals who are in crisis. The 7 stages are firstly to assess through a very thorough psychosocial and lethality assessment. Second is to establish rapport. Third is to identify specific current problems. Fourth is to explore feelings. Fifth is to generate alternatives. The sixth step is to develop an action plan. And the seventh is a follow-up. So we really get a framework here to help a patient in crisis and to stabilize them. So here in this case, the first step would be to give a thorough analysis, to perform a thorough analysis for the patient and to get an accurate diagnosis by incorporating a good dialogue with the patient and her husband by establishing rapport. And this would require a quick collaborating trusting relationship with the individuals. So based on the symptoms that are described in the case, the diagnosis would be postpartum psychosis. The symptoms have very sudden onset. They have worsened rapidly, and the woman is at risk for developing symptoms which may harm her and the child. These typically in postpartum psychosis develop within several months after birth. So the broad range of symptoms that we see in such cases would be symptoms of mania, depression, cognitive impairment, psychotic symptoms, paranoia, delusions, hallucinations. Postpartum psychosis affects 1 to 2 individuals per 1,000 of females of childbearing age. So the patient fits this criteria, and because it was sudden onset with rapid worsening and they started occurring 6 weeks after her delivery. Now, postpartum psychosis is considered a psychiatric emergency which requires inpatient hospitalization. The mothers who are at risk to harm themselves or the baby require immediate hospitalization. So I would at this point of time call emergency services on a priority basis to get the patient to the nearest psychiatric emergency facility. Once hospitalized, it is expected that the treatment would involve mood stabilizers, atypical antipsychotics, anti-epileptic drugs. They would also do lab tests to rule out other medical conditions or organic causes like hyponatremia, hyperglycemia, thyroid conditions. Now, postpartum psychosis is a very rare occurrence, but we have to be careful because it can lead to undesirable outcomes. The proper identification would make sure that the condition is managed well and any unfortunate consequences are prevented. It can lead to tragic consequences like suicide or filicide. There's a lot of risk to the infant. It is a period of tremendous stress for the family, the spouse, other family members, and at some point of time, the mother needs therapy as well as psychoeducation of the mother and the family. So a concrete plan is now developed to address the crisis, and this would be in collaboration with the family, and it's a psychiatric emergency, so she needs to be placed inpatient and immediate care has to be provided. The provider or would be involved after she is discharged from the hospital for follow-up to make sure that she is her condition is well controlled. There's no relapse. Their progress has to be evaluated and ensure that the treatment plan, action plan is working. She's getting the necessary therapy, and to identify if any other additional supports are needed. So this is an interesting case of postpartum psychosis, and it's a crisis situation which needs immediate hospitalization to make sure that the mother and child are safe. Thank you.